Welcome to part 2 of the presentations for this module. How did you go with the activity in step 3? In this part, we will learn about the definition of disability and some key terms that are used when talking about disability. On this slide, we can see some key facts about disability which help us to understand the prevalence and distribution of disability globally. As we heard in the first presentation, it is estimated that 15% of the world's population, or 1 in 7 people, have some form of disability. Disability is present in all countries, low, middle, and high income, and most of us will experience some form of disabling condition at some point in our lives that will impact on our participation in everyday activities or access to places that we usually go. However, we also know that some groups are more likely to experience disability than others. This includes women, older people, and poor people. In fact, 20% of the world's poorest people are likely to have a disability. There is a well-established link between disability and poverty. Poverty increases the risk of disability through things like poor nutrition, poorer living and working conditions, and poorer access to healthcare. On the other hand, people with disability are more likely to be poor due to lack of access to education and employment. We turn now to thinking about what is meant when we use the word disability. Disability is a concept that has changed over the years and means different things to different people, but developing a shared understanding of what is meant by disability helps us to plan, monitor, and evaluate programs and services that are inclusive of people with disability. In the United Nations Convention on the Rights of Persons with Disabilities, disability is defined as the interaction between persons with impairments and attitudinal and environmental barriers that hinder their full and effective participation in society on an equal basis with others. On this slide, we see an image of the WHO's classification of functioning disability and health, or ICF as it is known. The ICF is used to classify and understand disability, and like the UNCRPD definition, the ICF considers disability to be the result of an interaction between a person's health condition and their environment. The ICF uses disability as an umbrella term for impairments in body structure and function that result from a health condition and any subsequent activity limitations and participation restrictions due to that individual's context, which includes both personal and environmental factors. The definitions on this slide help us to understand some of the words used in the ICF. The impairments are problems in body structure and function that result from a health condition. For example, physical, vision, or hearing impairments, but may also refer to impairments related to cognition or executive function. Activity limitations are difficulties in completing everyday tasks or actions, for example, walking, eating, or speaking, which result from the impairments. And finally, participation restrictions refer to the problems people may face in engaging in everyday life, for example, going to school or work, playing sport, or going to social events. On this slide, we have applied the ICF framework to the situation of a child with cerebral palsy. Imagine that this is a 12-year-old boy living in a rural village with his parents who are farmers and his 4 siblings. He does not attend school because he cannot walk independently and he cannot get on the bus to go to the school in the next village. He has a wheelchair, but it does not drive well on the very rough roads around his village. He spends most of his day at home, cared for by his grandparents. He has difficulty chewing and swallowing his food, with some of it falling out of his mouth as he eats. Usually, his grandmother feeds him away from the rest of the family because of the mess. Now let us look at this boy's situation in terms of the ICF. In this case, the health condition at the top of the diagram is cerebral palsy. The impairments of body structure and function for this boy is poor control of the movements of his body and mouth. This impacts on everyday tasks such as walking, eating, speaking clearly, and catching a ball. For this child, these impairments and activity limitations in interaction with his context, which include where he lives, poor access to transport, poor access to services such as therapies and assistive technology, result in him being restricted in participating in many of the usual activities of a 12-year-old boy, such as going to school, eating meals with his family, playing sport, or attending church. From this example, we can see that if a child with the same health condition and impairments lived in a different environment, for example, where he could access a school more easily or had greater access to assistive technology, that his experience of disability may be different. In summary, both the ICF and the UNCRPD recognise that disability is not just about a person's condition or what is wrong with them, but that it is the interaction between impairments resulting from a health condition and a person's social and physical environment. The idea that a disability is a result of this interaction represents a significant shift in how disability is understood and how people with disability are viewed by others, and teaches us that every person's experience of disability will be different. With this in mind, it is very important that we are aware of the barriers that people with disability face in their environment and in society, and address these barriers so that they can participate in all areas of life on an equal basis with others. And this includes being able to access healthcare. Over the remaining modules of this training, we will be learning more about the potential barriers to healthcare for people with disability and how we can work to remove these barriers. Now please turn back to the workbook and complete the activity in step 5 to further your understanding of what is disability. Then complete the step in step 6, where we will return to the flowchart of a patient's journey in accessing healthcare and some of the challenges they may face.